Hi, everyone. My name is Wency Liang. I'm a health reporter at the Globe and Mail and moderator for today's conversation. It's my pleasure to welcome you to Perspectives on Brain Health in Chinese Communities in Canada, presented by Dementia Talks Canada. This talk is presented by the Alzheimer's Society of Canada in partnership with Brain Canada. You can find out more about both of these organizations in the chat. Before I jump into welcoming our panelists, we just need to go over a few housekeeping items. This session is being offered in English, Mandarin, Cantonese, and French. To select a language, you can click on the interpretation button at the bottom of your screen and then choose English, Mandarin, Cantonese, or French language. You'll also notice that poll questions will occasionally pop up on your screen throughout the session. The poll answers are to help us understand if we're meeting your needs, so please do provide your feedback. This talk is being recorded and it'll be made available on the Alzheimer's Society website and on its YouTube channel early next week. So lastly, this is a conversation. This chat is open and it's being moderated. So please do send your questions through the Q&A. That's the feature on your Zoom there. And we'll do our best to get your answers, or so get your questions answered. And any that aren't answered during this hour session will be followed up by email in the days to come. So please do provide your contact information with your question if you want a follow-up. I'm coming to you today from Toronto. This is land that is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And it's home now to many diverse First Nations, Inuit, and Métis peoples. I acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit, and it is my privilege to be able to have the opportunity of being on this land. The Alzheimer's Society of Canada encourages you to learn more about Indigenous-led and co-led initiatives in dementia. And this includes, but is not limited to, the Native Women's Association of Canada's Dementia Toolkit, Anishinaabe Dementia Care, the Canadian Indigenous Cognitive Assessment, and dementia resources from the National Collaborating Centre for Indigenous Health, just to name a few. The websites of these organizations are now in the Zoom chat for you to use, to share, support, and learn from. And now it's my pleasure to introduce the panelists who are joining this conversation today, all of whom provide important perspectives on today's topic. First, let me welcome Dr. Roger Wong. He's the clinical professor in the Division of Geriatric Medicine in the University of British Columbia's Department of Medicine. And he's a consultant physician of the Geriatric Consultation Program at the Vancouver General Hospital. He's the Vice Dean, Education in the UBC Faculty of Medicine and has also been a popular TEDx speaker on how to keep elderly parents safe and in their homes longer. Next, we have Dr. San Ng, CEO of Yi Hong Centre for Geriatric Care. Yi Hong is one of Canada's largest culturally appropriate seniors care organizations, and it offers long-term care, home and community support services, palliative care, and an institute for social innovation in aging. Dr. Ng is passionate about supporting older adults, their caregivers, and loved ones to, in her quotes, live their lives to the fullest with independence, health, and dignity. And last but not least, we welcome Shirley Tam. She's the volunteer facilitator for Chinese-speaking caregiver support groups at the Alzheimer's Society of BC. Shirley's mother was diagnosed with Alzheimer's disease in 2018, and Shirley has been very involved in her care until she passed away in a nursing home a few months ago. Thank you all so much for joining us. And now it's my pleasure to begin our group discussion. Perhaps I can start with Shirley. Shirley, what do you think more people should know about brain health and dementia experiences in Chinese communities in Canada?
Oh, I didn't expect to be the first one to answer this question. So I was prepared to make supplementary comments, but I feel there is still a lack of understanding and awareness of this disease in general, in about brain health as well as dementia. um, the fact that dementia, even in the wider community, carries certain stigma is a well-known fact. And among the Chinese community, I think this is even more pronounced, because Chinese oftentimes don't even want to know about it. They want to hide. If they have a family, they want to hide the fact that they have any thing have to do with the brain disorder. And so they consider dementia is a kind of brain disorder, and it's like associated with mental disease and all things brain related. So this is an area of taboo in a way. And it's interesting. I'm trying to speak with some personal experience rather than like from the expert point of view, because I know Dr. Wong and Dr. Ng will share a lot more about this information. But I want to say something. Before my mother was diagnosed to have dementia, I have only heard of 2 cases of like friends who had family members suffering from dementia. Like in my 20 years of living here, 2 cases. And then after my mother got diagnosed, all of a sudden I hear them more, because I was the one who started sharing about this. And then I thought, oh, someone actually would say, oh yeah, my mother also had dementia. Oh, I also, someone has dementia. But this conversation never existed before I started that. So it kind of showed that in the community, there is a bit of a reluctance to discuss openly about this. So I leave it at that, and I'm sure the other panelists will add to it.
Thank you. Roger, how about you? What do you think more people need to know about brain health and dementia experiences in the Chinese communities?
Well, thank you so much, Wency, and hello, everyone. Delighted to be joining this conversation today, a very important conversation, a timely one, I would add. I want to first and foremost respectfully acknowledge that I'm coming in today from Vancouver on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh peoples. And I recognize that all of you are joining us today from coast to coast to coast, and I want to respectfully acknowledge the traditional owners and caretakers of those lands as well. And that's a very important concept, because even though we're talking about the Chinese communities and the experiences across Canada, we must remember that there are there's a huge diversity of populations amongst Chinese communities. We are all very unique, and unique in ways that some of which could influence the conversation that we're having today. And thank you so much, Shirley, for sharing your personal story and observation. It is something that resonates with us as well. That we know that within our communities with Chinese ethnicity backgrounds, that there appears to be not only a lack of understanding of the condition in terms of brain health and dementia, but more importantly, dementia care, and that includes the most common type of Alzheimer's dementia. There is also, and Shirley talks about it, there's also feelings, values, attitudes that kind of mystify the whole situation. It becomes kind of a self-fulfilling prophecy when it comes to stigma, because there's a feeling of, oh, this is not something good to talk about. If it happens in a family, let's kind of cover it, hide it, stay within the family. It therefore results in many missed opportunities of support and help. One of the first things that I share with many of the individuals living with the condition is I say to them, please understand you are not alone. And that sentence itself is really powerful. I say you are not alone because we know the number of individuals, Canadians, living with dementia is on the uprise. The Alzheimer's Society of Canada has published its report last September called the Landmark Study that looked at the number of Canadians living with dementia, including Alzheimer's dementia, the most common type. Current numbers just over 600,000, and in 30 years, increasing 3 times to over 1.7 million. And if people are not talking about it, they're not sure what it is about, it represents huge missed opportunities. Layer in other determinants of health, social determinants of health, whether it is because of language, whether it's because of culture, socioeconomic backgrounds. And again, in practice, we see all of these things intersecting with each other. That is kind of the basis of a lot of the stigma, the false belief that is created. So I think, to summarize, I think what we really need to do a lot more is how do we promote awareness? And at the same time, how do we remove stigma? I think that's kind of the essential work that we must do right away.
Thank you so much, Roger. San, maybe you can offer some of your perspectives on what you think more people need to know.
Yeah, I very much agree with what Shirley and Dr. Wong had mentioned. I think to take it one step further is that dementia can be a progression as well. And so what we find at Yihong is that by the time we have people coming to us, either caregivers or residents or clients in the community or in palliative care, is that they're really at late stage dementia. And it's so significant and impactful that it's really challenging to provide all of that support all at once. And so it's really recognizing and acknowledging that something might be changing in your loved one or yourself, and coming forward to access those resources and not being afraid to learn about dementia and your own condition. And it may or may not be dementia, but how can we normalize that it's actually healthy? Just like we go to our physicians for checkups every other year or every year, this is part of aging, and it is a disease, but we need to look at it as part of holistic health and well-being. And at Yihong, yes, the brain obviously, is really important, but we also want to look at all of the other aspects of the person's life and what they enjoy and what they need from a social perspective, spiritual perspective, in addition to the physical perspective and family perspective, to be able to enjoy their lives again as much as possible, no matter what stage of dementia they're at. And so I think moving from a disease approach and kind of medical model, although we absolutely need that as well, to a very person-centered, culturally appropriate model will really serve well in terms of normalizing and embracing the whole person in their dementia journey.
Thank you. We'll get it into the how people can live their best lives with dementia a little bit later. But I wondered if maybe Roger, you could take this next question first. How has your many years of research and work in this area influenced how you your perspective on dementia and brain health in Chinese communities in Canada?
Well, thank you for the question, because there's just a huge amount of work, I think, right across Canada, right here at home across Canada, and also around the world. There are many researchers who have been hard at work, really trying to figure out different aspects of providing better care for dementia, for Alzheimer's disease, the most common type of dementia, because our hope is one day we can cure Alzheimer's. And I do think, while we are not quite there this moment as we speak, there's a lot of promise in terms of the things that have come across over the years. Many people think about, okay, research into dementia, we must be trying to figure out ways of, finding earlier diagnosis, more accurate diagnosis, prediction of diagnosis, and then in the treatment side, obviously everybody's looking for the magic bullet to cure Alzheimer's and other dementia, or at least to slow down the progress. I mentioned these areas because in each and every one of them, there's just so much research going on, both in the biomedical space, but also, in terms of the caregiving, the quality of life space in these areas. A lot of work happening right here at home in Canada and around the world. So I am hopeful. Now, that said, we don't have the cure yet. And so a lot of the research is also about supporting people living with the condition, supporting their loved ones, their care partners, families, friends, neighbors, communities, local communities. And that work is right here and now. That work is really important. For myself, I've done a lot of work really trying to understand how do we provide culturally sensitive services and care to individuals who may come from diverse backgrounds, underrepresented in the entire population. And the Chinese communities is a good example of that. But as I mentioned before, we also have learned that social determinants of health can intersect. There are multiple things going on at the same time. So while it is important when we think about culturally sensitive services to think, okay, language, how do we overcome language barriers? Well, language is only the beginning. It's not the entirety of the solution. How do we do things that is aligned with the values, attitudes, and beliefs of individuals who are living with the condition and also the loved ones and the care partners? And the care partner is a really important piece. We know there's a lot of caregiving that is going on, what we call unpaid caregiving. Sometimes people talk about informal caregiving, but to the caregivers, any caregiving is as formal as it gets. On average, 26 hours per week of caregiving is provided to each and every one Canadian living with dementia in Canada as we speak. That's like a full-time job, except it is not paid for. So how do we support family, loved ones with, support networks? The Alzheimer's Society of Canada has the First Link program. It is very nicely coined, the word first link, because it is the first linkage, a lifeline to individuals living with dementia and also their loved ones. How do we extend the service in culturally sensitive and safe ways to reach out to diverse populations, including, for example, Chinese communities? I think that's a lot of work and the research that has been going on. And the final thing is, more recently, a number of my medical students and myself, we published a study that looked at the effects of music therapy in terms of helping to support individuals living with dementia, living with Alzheimer's. And if there's interest, we're happy to talk a little bit more about the power of music or any important hobbies to an individual to really maintaining the personhood, because a person living with dementia is still a person. That personhood is so important for us to maintain.
Great, thank you, Roger. I think Shirley may have something to talk to on the subject of music therapy. But let me just throw to San just for a moment first. On the subject of supporting caregivers, I wondered, through your work, San, could you be able to talk about a little bit about how your work has influenced how you see caregiving in terms of people with dementia in the Chinese communities?
Oh, absolutely. Yihong has a really large caregiver support program, and our approach and philosophy at Yihong is that you are also our family members, and meaning that, yes, you are supporting your loved ones, but we also see you as part of the integral circle of care. And so with respect to supporting caregivers, when, for example, people come to our adult day programs that are focused on dementia, we also teach and support our caregivers on what to do at home, right, with the many things that they, the person goes through or learns during their time during the adult day program. We have tried many different kinds of technologies, whether it's virtual reality or we have a play intervention toolkit that we developed with the University of Toronto. And all of these, tools and technology and whatnot can also be done at home, right, when the person is there with their loved ones. And so they're absolutely, caregivers are absolutely integral to how we provide our services and programs at Yihong, and we're always building capacity and involving them in telling us, what do they need, right? What would help you and what do you need? And I think, just going back a little bit, but just really unpacking what Roger and Shirley said, it's not only stigma, there's a deep, deep sense of shame and failure, and the fact that I can't do enough or more, or even, exceed what I'm already doing, whether it's 26 hours or even more than that. And I think, as we've said, being there with the caregiver so that they're not alone in their journey is a huge, benefit to not only us in understanding what the caregiver needs and the loved one, but hopefully as a support to the caregivers as well, that we're always there, we're just a step away. So I think we do need to absolutely recognize and build the caregiver community, but also to give them the resources and funding and support in order to do that, because it is not, as Roger said, informal. It is very real and present, and it always has been. It's just unrecognized. So in everything we do, we need to have the caregiver and their loved one at the center, and then we design around that.
Sun, could I just get you to unpack a little bit? In our previous conversations, you had mentioned that there is sort of this element of self-sacrifice, and you mentioned this idea of guilt. Can you just kind of like unpack that just a little bit?
Yeah, I think, it's this sense that because we are a very familial culture, right? We really value and respect our elders and the family, and all of that, is that there is a lot of guilt associated with, I'm not enough, I'm not doing enough for my husband or wife, or my parent, or my relative. And it's just, I think this, sense that we need to sacrifice as much as we can in order to support our loved ones. But at the same time, we are not taking care of ourselves, and we are burning out, right? We are also experiencing, challenges and decline and things like that. And so I think this whole sense of taking care of yourself so that you can take care of others really needs to be brought back, and that it's not selfish actually to take care of yourself so that you can take care of others. Okay, you need to take care of yourself. And so I think that's really challenging for many people, because it's very sad and it's very hard on people to see their loved ones not be who they used to be. And so you just do more and more and more. Meanwhile, you're taking away from yourself more and more. And it becomes a declining cycle of, this dynamic whereby you're not able to help your loved one as much as before, because you yourself are becoming less mentally healthy or physically healthy or spiritually healthy. So we really need to build on the assets of individuals, not have a sense of shame and guilt and regret, that you also need time for caregiver respite, and you need to have quality of life too. And we need to, find supports for your loved ones. You don't need to do it alone, and you have a right as well to take care of yourself. I think that's something very deeply entrenched, and something that we need to help people recognize and kind of reflect on, but also get supports for themselves.
Thank you so much. Shirley, over to you. Roger had talked about, a lot of the research that's going on, and we don't have a cure yet, but that there are ways of sort of, helping people to live the best that they can. From your experiences, how of caregiving, how has that impacted the way you view dementia?
Yeah. I'm happy to talk about that, but before I talked about that piece, I'd like to actually respond to what Dr. Ng has said, because I can agree more about the need to support caregivers. And I'm so thrilled to hear of all the programs that is available through Yihong. And I wish this is available on the West Coast as well. Because the one thing that I have noticed throughout the last few years, I have the privilege of journeying with a lot of caregivers. And I myself am a caregiver for a few years too. And to see the amount of burnout that was experienced among the caregivers is really heartbreaking, And I think we've all brought up the issue about the traditional filial piety culture, where, children feel an obligation to take care of the elderly as much as possible, and as far as possible, keep them at home and do everything for them. And as a result, they don't have a life, and they are totally burned out. And imagine someone, we are not talking about just looking after them, cooking and feeding, but there's so many more with a person who is suffering mid-stage to end-stage dementia, just cleaning after them, monitoring every single action, so that they don't burn down the house, they don't, mess up the carpets, they don't do something that will cause danger to themselves. So it's tremendous amount of stress that they carry. And I think that is something I would like to see, more support available to them. And another thing to mention is that we probably will see this more as there are more Chinese coming in, for example, from mainland China, who traditionally, for a good number of years and now, that there is the single child policy. That means only one child is responsible to take care. So no one is sharing that load. And because of the element of shame, they are not able to share with anyone. They don't have support. And as new immigrants, the social network is also relatively weaker than their counterparts here in Canada. So all this added together means that caregiver burnout is a reality. It's a very acute problem. And then the language issue that we all recognize. So then going back to your original question about, how we can support caregiver to support our loved ones. I think one thing I noticed for Chinese family is that there is a focus, as Roger has already mentioned, the focus on finding that magic cure, finding a medication, something that can stop disease, that can reverse the disease. And the non-pharmaceutical intervention is not really in the vocabulary. It's not, they don't think about what else can they do. There are a lot of things that can be used to help moderate or to improve to some extent, to give them quality of life. And I noticed that, in my interaction with caregivers, all that they are concerned is, okay, they don't cause trouble, that they are safe. So they ultimately, I find a lot of the dementia patients were understimulated, the Chinese patients, because they really are left in a very safe place, in the best scenario, so that they don't cause trouble to the family and they don't create safety issue for themselves. But then there is nothing to give them quality of life. So Roger brought up, music therapy. I happened to discover that I would stumble upon that. I discovered my mom loved singing. And then my daily visit, I would bring my iPad and I would sing with her. I would let her sing. Initially, it was actually embarrassing because my mom loved singing to the point that she would sing at the top of her voice, going anywhere, in the dining room, in the park, and so on. I cringe, but then I realized she's happy. Why don't I just, nourish that aspect of her? And so ultimately, I noticed she flourished. That is amazing. So I went into the care home, not only with me helping my mom having a good singing lesson or listening to videos. YouTube is wonderful. I always have a phone and an iPad with all the oldies. And that's another thing. Chinese people, you have to find the appropriate oldies for them. And, despite the best attempt in care home here, or they would play some, Elvis music or something, but it doesn't resonate with Chinese. And so this is a very simple way to modulate their mood, to give them some joy. Play games is another one. I think once again, we underestimate the power of little things like this. It doesn't cost anything. I got this badminton racket and a balloon, and I start playing with my mom, and she loved it. Just whacking the racket and hitting the balloon. How difficult is it? I started off playing with my mom, and soon I would see residents all coming and kind of say, "Can I join you?"
Wonderful. Roger, do you have, oh, sorry.
Okay,
Sure.
yeah, so I just
Roger,
want
do you have
to
any?
promote this, yeah.
Roger, would you like to add anything to that or comment?
Absolutely. And yeah, no, thanks so much, Shirley and Zen for sharing. I think what we are talking about is for each individual living with dementia, living with Alzheimer's disease or any other form of dementia, it is really helpful for us to understand each and every one of them as a person. And what do they like? You know, they may really like photography. So looking at old photos from the past, whether it is on a tablet device or a good old photo album, is helpful to generate a conversation so that you can have some kind of interaction with the person living with the condition. And this is an important part of caregiving. And, you know, as care partners, we are all looking to really tailor an approach that is going to really bring fun and fulfillment as a result of our love and our compassion for the person. So it could be music, it could be photo, it could be a book. I have met many individuals living with dementia and their families and their care partners share with me, oh, Dr. Wong, they love reading, but what they end up doing is the same book and the same page one, all the time, repeatedly. That's okay. They love singing, and they can only sing the first stanza to a Chinese opera or to an Ellen Tam song. Now that has become an oldie these days, which is totally fine. It is okay. The dialect and the language, if there's any way that you can tailor and customize that, that's even better. And that's because anything that is familiar to the individual living with dementia is going to be a really powerful tool for us to really get the person who the person is, to get some of the fun and the fulfillment back. We know that individuals living with dementia, at least in the early to middle phases, distant memory is still relatively preserved. And so you can try to use those kind of techniques. The final thing I would add is don't underestimate the power of intergenerational kind of interaction. And we might have heard about whenever we have babies in the crowd. In fact, we know that by using music or having babies around, individuals living with dementia, including some of those who may have some behavioral and psychological symptoms or issues arising from dementia, they may be able to get a bit calmer. And in fact, there is some evidence to suggest the amount of medicines that are needed to help them manage can be reduced as a result of some of these non-medicinal approaches. Now, clearly, safety is really important. We have to make sure everybody is safe first. And within that kind of setting, non-medicinal approaches can be very helpful. Now, the final thing I would say is for Chinese individuals who are living with the condition, how do we systematically build in within our policies, our processes, these kind of services? Because right now they are around the country, but they are in pockets. And how do we extend those pockets into the entirety of the country? That is something that we really need to urge and help our policymakers understand the importance.
Thanks, Roger. We'll talk about the policy in just a second, but I wanted to give San the opportunity to respond to what both Shirley and Roger were mentioning about connecting with the person who has dementia. Do you have some? Yeah.
Absolutely. I think that, you know, as Roger and Shirley have said, each person is different, even though they may be Chinese Canadian. And what we do at Yihong is we know that, you know, long-term memories, right? Long-term memory is still there at times, and understanding what are those positive memories for that person, and bringing those, whether it's food or art or music or some other, you know, cultural type event. It's really helpful to ensure that the person has access to those. And it's often through the caregiver and the family members and the intergenerations that we learn about what grandma or grandpa really liked, you know, or really likes. And so we need to do that as well. I think that at Yihong and elsewhere, we also focus on an asset and growth-based model. And what do I mean by that? Alzheimer's and dementia is seen as a decline and a lack, but we want to start from where the person is at and recognize what they still have in terms of recognition and memory and, engagement, and to build from that and to prevent decline rather than, oh, we need to restore back to what they were before, because that may not be possible. And so I can give you a few examples if that's helpful, Wency, just really quickly, is that one of my directors, actually, two of them were talking to me in preparation for me to be here today. And they told me the story of a son and his mother. And, when he was growing up, the mother, of course, cooked all the dinners, and everything was ready when he came home from school or work and whatnot. And her dementia is so advanced that she can't cook anymore herself because it's not safe and all that, and she can't physically cook anymore. But he learned from one of her programs that you can involve someone still. So he got everything ready for his mother. He prepared everything. He washed the rice. He got all the dishes together, set the table, all of that. And all what he would do every day is say, "Mom, remember, I know you want to cook dinner. All you need to do is to go to the rice cooker and press the button." And that little act alone made her feel human, and that she's still a mother. She's still caring for her son. She's still participating in providing a meal for her family. But it became, that one act that was representative of what she, contributed as a mother. So I think that, just to kind of really boil it down, it doesn't have to be a big thing. It could be something very simple and something very engagement oriented that gives the person dignity and a sense of individuality and contribution still. And we need to look for those things. But of course, it's going to be different for each person.
Okay, thank you so much, San. I want to move a little bit from the micro to the macro now. Roger, can you kind of brought this topic in, but on the subject of policy, like what do governments and decision makers need to know about brain health and dementia in Chinese communities in Canada?
Well, thank you, Wency. One of the things that I really have tried to help people understand, and that includes all of our colleagues within government, and I'm talking about both in the provincial territorial level, but also in the federal government level, is the urgency for us to taking action right away in terms of supporting individuals who are living with dementia and their care partners. Dementia care is good health care, and therefore we must act right now. In Canada, we have a strategic plan. We have a Canada Dementia Strategy document that has been formulated. The question really is always about implementation. Like, how do we put the recommendations into action? And implementation in a way that is culturally sensitive and supportive for individuals living with the condition as well as the care partners. But also, we have to make sure that it has to be sustainable. It's not just a one-off, not just pockets. And that requires coordination, that requires that overall big picture view. At the Alzheimer's Society of Canada, a lot of colleagues have done a lot of work trying to continue to help individuals who are in kind of the policymakers kind of decisions, the lawmakers' decisions, to understand that we need some enablers. So a good example is, how do we empower care partners and people living with the condition, living with dementia, empower them with the knowledge that actually is translated from evidence, from research, not just biomedical research, but quality of life research. So the Alzheimer's Society of Canada, Alzheimer's basically Society Research Program, the ASRP, is a national program that funds researchers from across Canada in these two big important areas of research, biomedical and quality of life. And in doing so, how do we layer in the cultural sensitivity, research and services that are tailored to meeting the needs of diverse populations, including Chinese communities? So that also is at work at the national level and Alzheimer's Society of Canada, as well as in partnership with our federation partners. There are Alzheimer's societies pretty much in every single province and territory in Canada, and we are partners with that. We hear from Dr. Ng in terms of the importance and the power of social service organizations, grassroots in the communities. Yi Hong is a good example in Toronto, in Ontario, in BC, and the example is success. And there are other examples. But, partnership with local community-based organizations from the grassroots is really important. The final example I will give is many of us might have heard of the term neighborhood watch. Historically, we think about connection about security, safety, policing, and so on. Well, I have a new idea that I've been really trying to venture that to a lot of people. Neighborhood watches can be about supporting individuals living with dementia and their care partners. How do we create dementia-friendly communities? The neighborhood needs to be a safe space, not only in terms of stigma-free, but in terms of looking into the little things that make the lives a little bit easier for people living with dementia and their care partners. For example, we know that individuals with Alzheimer's dementia and other dementia are at higher risk of accidental falls. So if we want to make sure that the landscape is even, there's no uneven ground, and then, traffic lighting within intersections are safer, they're good not only for individuals living with dementia, they're good for everyone. So dementia care is good health care. That's the message that we need to get across.
Thanks so much, Roger. San, how about for you? What kind of message do you want to
Dr. Wong
offer?
took the words right out of my mouth at the final stages there, is that age and dementia-friendly communities. Okay, we need to understand who are Canadian citizens, the proportion of the aging population, and how do we think that in every aspect of design, whether it be, outdoor spaces or indoor spaces, or just the overall environment and how that's supporting our population as a whole. I also think that from a federal, provincial, and territorial and municipal perspective, governments need to work together. Yes, different governments focus on different things, but at the federal level, something that I've personally been advocating for is, for example, tax relief or tax credits or whatnot to support caregivers so that they can participate in caregiver respite programs, that they have an opportunity to, have some funds to do that, for example. At the provincial level, absolutely, we need to work within our provinces and delivering health and social services. But I think we also need to share that knowledge transfer and exchange across provinces. And that's what we're doing today, which is really good. And I think, at the municipal level, we really need to look at how we support things such as, housing and in-home supports and things like that to really ensure that people have that support as well. So overall investments, okay, we need investments. We cannot continue to just do more with less. We need investments in research and technology, in practices and programs. And I think, a coordinated effort, all levels of government and across Canada is really essential so that we leverage what's in place. There's a lot that's available already through Alzheimer's and through Dr. Wong's work and at Yi Hong, but we need to bring that out to the communities and to reach the people who actually need it, which is the caregivers and people experiencing dementia.
Thank you so much. I want to make sure that we have enough time for questions, but Shirley, can you offer what
I don't think I can get more than what Dr. Wong and Dr. Ng has already said, but I can only say the wish list from the perspective of caregivers. I wish that there is a roadmap that families can follow the moment that they get a diagnosis, that they are not left in the dark, particularly when they are linguistically challenged. They don't know where to find information. Like when you get a diabetes diagnosis, you know that diabetic clinic, they follow you, or there are very systematic approach in healthcare to follow up. But with dementia care, there isn't. The next stage would be when you get into a long-term care, when you get into a hospital because of a fall. So there is a gap, and how do we bridge that gap? The continuity of care, let me borrow that language to say that from the moment when the diagnosis is made, to all the way to support not just the dementia patient, but also the caregiver. So pull all the resources together, collaboration, among the different organizations, different parties, jurisdictions, and the levels of government. I think they all have been mentioned before. So I'm just coming in from the perspective of the caregiver to say, this is my wish list. I want to see the continuity of care, and I want to see team-based work and not being left to suffer in silence.
Thank you so much. And thank you to you all for such an interesting discussion. So I'm going to now turn it over to the Q&As. And I'll choose a question from the Q&A box. Just a reminder that if you ask a question and we're not able to get to it live, the Dementia Talks Canada team will do email follow-up with you in the days to come. Just provide your name and your question if you want that follow-up. So let's see. This question is, I read that excessive daytime napping may increase the risk for Alzheimer's disease, and conversely, Alzheimer's disease may lead to more daytime napping. This person who's asked the question says, my husband who has mild dementia naps a lot, especially after suffering from compression fracture. What should I do to help him? Roger, maybe you could take this question.
Absolutely. It's a common question that we see clinically. So let me start by saying that while there could be some observations, and as this audience, thank you for sharing your observation. This observation is that there is some kind, or is there some kind of relationship, association between sleeping pattern, a change of sleeping pattern and dementia? What I need to say is it is very individualized. There are lots of variation. But I would say in general, we know that, the comment about, is there a definitive relationship between excessive daytime napping and the development of Alzheimer's dementia later on? The answer is not exactly. What we may be watching or seeing is the effect of a day-night reversal, a change of the internal body clock, so that people sleep less during the nighttime and therefore making up and catching up with napping during the daytime. And in other words, the development of the Alzheimer's dementia might have been ongoing already, but it is showing itself in different ways. Now, what can we do? I think I would suggest two things for your consideration. Again, without seeing the individual, it's not possible to give specific medical advice, but in general, there are two things that we think about. Number one, can we try to have an understanding in terms of, that balance between the nighttime sleeping and the daytime napping? In other words, is there a reason why the person is not really able to sleep well at night continually? For example, does it have to do with the fact that a person might need to wake up and go to the bathroom and use the toilet, so nighttime urination is kind of a common reason. And if so, is there something that can be done to try to change that? And then the other aspect is, well, during the day, how do we help the person stay up, maybe through exercise, socialization, combination thereof, some group activity, and then try to say maybe the person will avoid napping during the day as much as possible, keep moving, and then at nighttime they can sleep. So those will be a couple of general considerations.
Thank you so much, Roger. I have this other question here. Any suggestion on how we can help Chinese communities understand that dementia is not a shameful thing, so that their caregivers would be aware of the symptom? Oh, sorry. Let's try that. So maybe San, can you take on this question? How do we help Chinese communities understand that having dementia is not a shameful thing?
Yeah, I think it's talking about it through communities and in groups, and to really not feeling alone that you yourself need to do all of this yourself and overcome everything. And I think once people have that caregiver support and feel that, you know what, yeah, other people experience the same feelings and have the same challenges and are working together to find, those solutions, I think that's where you become stronger. And so I think, by understanding that, this is a common experience and accessing those supports, and you learn from others. The most powerful way of communication marketing is word of mouth. Okay, when someone like Shirley goes and talks to another family member or caregiver, they learn from her. And because only Shirley can understand, right, in terms of her experience. And so I really think that we need to create those communities of sharing and those supports around the country, and to talk about it from a culturally appropriate way. What is it like in not only Chinese culture, but different Asian cultures and other cultures? What is it really like when such and such happens and you feel a certain way? And to talk through how people have learned and grown through their own experiences to overcome those challenges, as we've talked about, of guilt and shame and whatnot, right? We need to learn from each other, and there's lots and lots of supports, written supports and videos and things like that. But I think it is sharing experience, real experience, and learning from each other that will really help us to learn what's helpful to us and what we can do.
Great, thank you so much. This is a question for all panelists, but maybe Shirley can be the one who takes this. What is something that you wish researchers like Roger would consider when doing research on how specific cultural groups experience living with dementia?
Oh, I certainly love to see more research specific to the Asian culture. Off the top of my mind, it's hard to think, but then, I think our interests, our hobbies, and these are areas. Say, for example, I know there is a big emphasis on the role of creativity in helping with dementia patients. But what would that context in Chinese culture looks like? Does it have to be learning to draw and paint, and what other things can do? Games, I mean, we all well known that, mahjong playing actually can stimulate the brain. I don't know if there is any research being done. I just think of research that is more specific on it. And the other thing off the top of my mind, I think of is even the diagnostic tool. Is it a culturally appropriate tool that we are using right now? I know when I brought my mom to see Dr. Wong, he modified the tool a little bit, which is great, but is it being done elsewhere? Because that tool is developed with a very specific audience, but not the Chinese audience. So that's just the two things.
Great, thank you so much. We'll have maybe time for Roger just to respond to as well, and we'll have to wrap up. But Roger?
Absolutely. So I think we need to remember research is care. So sometimes people think about, this is about research, this is about care, but research is care. It's a continuum. And therefore, to me, the most important question to try to answer through research has to be the question that are raised by people living with dementia and their care partners. And so if you think in terms of that, and Shirley, thank you for sharing that from a Chinese population perspective, like if I were to think what could be one or two most common question that people living with dementia and their care partners would raise, it probably comes down to the following two. One will be, am I going to get it? So family members typically would say, it addresses kind of a genetic or hereditary component to dementia. Now, there are many types of dementia, Alzheimer's dementia being the most common type. And then our understanding of the biology that we see in individual populations, do they translate into underrepresented populations, such as Chinese population within a Canadian setting? That is a question that really hasn't been answered to date. But then another common question, that care partners and people living with the condition will ask is, and Shirley talked about it, it's a question about knowledge translation and transfer and exchange. is help me understand what is this journey going to be like? And is there going to be a variation? I'm not talking about the biological journey, but the lived experience journey within Chinese population. In my experience of many, many years working with individuals from the Chinese communities, I would venture the answer is yes, it is a unique journey. It is unique for every individual, but in particular within the Chinese community is unique. But how is it unique? And more importantly, once we know the differences, what are we going to do about it? Because we, as a community, as a society, as San was talking about, what can we do through processes and policies? Can we support people? I think those are the two questions. So one is more like a biomedical, the other one is more like a quality of life, that journeying experience. I think those are two really important questions. And this is where research can be care.
Great. Thank you so much. And thank you all so much. We're getting close to the end of the hour. Thank you so much for the Dementia Talks team. The Dementia Talks Canada team will follow up in the coming days with people who have asked questions that we weren't able to answer in this live session. Thank you all once again to the panelists and the viewers for your participation in today's talk. Just so you know, the recording of this session will be posted on the Alzheimer's Society of Canada's YouTube channel in the coming days and at alzheimer.ca/talks. Any feedback about this event or questions can be sent to publications@alzheimer.ca. And thank you again so much for joining, and have a great day.